computer, and let me go to live on Facebook here, and then we'll be ready. You want to do a test with everybody?
I've been listening while you guys were chatting, so we're good.
Okay.
Oh, good. All right.
Efficient engineer. Good for him.
All right, give me 1 second. Let me just.
One thing though, Maureen is a little bit quiet. If you can boost her just a bit, we'll be okay.
Okay. Is that better?
Yeah, that sounds better.
That's better? Okay. I just turned up the gain. Does that make it better?
Yeah, you're good now.
Okay, great.
Okay, everybody, we're going live on Facebook now, so stay tuned for an amazing episode here. Let me just put here, the title here is Fasting.
Look like you're driving a race car.
I know. It's hard to see these little text things. I need bigger glasses, I think.
Stronger
glasses and bigger. I'll get big ones.
Some goggles.
Okay, I think we're on Facebook Live now. Josh, how much time do we have? Josh?
He's gone. It's 2:01, so we should be on.
I don't hear him. Josh? Hello? Everybody here, we're on Facebook Live, and we're just waiting for the engineer to turn on the show. So give us a moment. We're going to be talking here about fasting with the world's famous expert here in diet, and also, more importantly, fasting today is Dr. Michael Klaper. You want to turn that down?
Mm-hmm. I'll turn it all the way.
Okay, where is he?
There we go.
I don't hear him.
All right, we got a little less than a minute. We'll be live.
Okay, great. Okay. All right, everybody. I got nervous. I was like, what are the silence between? All right.
Celestial voice.
Yeah, I was like, oh no, repeat of last week, the silence. All right, everybody.
Got a great radio voice.
Yeah, everybody on Facebook Live, thank you for joining us. Please start sharing this video if you want to learn about fasting. Anything you've heard about fasting today, we're going to answer the answers to the definitive question of what is fasting and all the different types of fasting and how that can really help you take back your health. And we have the world's expert here, Dr. Michael Klaper. So right now, just start sharing to all your family and friends. Share this link. Also, go to YouTube later on and subscribe to our House of Sanjevani YouTube channel so you can watch, and all these things will pull up in your links automatically. So stay tuned. We'll be on for a few minutes, and then we'll have a great show. Maureen, you want to say anything?
Oh, I want to do a shout out to Denise and Ula and Linda. Thank you for
All right, here we go.
Day Health. Visit us on the web at fivita.com.
The following program is being brought to you on the Voice America Health and Wellness Channel. For more information about our network and to check our additional show hosts and topics of interest, please visit
Welcome to Take Back Your Health. Your hosts are Dr. Sunil Pai and Maureen Sutton, who will explain the shocking truths about healthcare, prescription drugs, food and supplement industries. They will help guide you to take back your power and feel great again. Now, here's Dr. Sunil Pai and Maureen Sutton.
Welcome, everybody. Today is a great show. Today we're going to talk about a topic that's really popular right now. It's been popular, but it's really coming up a lot on social media, and we wanted just to tackle it today with one of the world's leading experts. It's perhaps the oldest and most powerful dietary intervention imaginable, fasting. Right? Fasting has been used in almost every culture for healing diabetes, heart disease, cancer, and other chronic inflammatory conditions. And if you've been thinking about how to fast or what is fasting, then you want to listen to this show to the complete end and probably keep on listening on the YouTube channel, because a lot of information will be presented here. We have a special guest, and we're going to talk about intermittent fasting, water fasting, juice fasting. Should we even do ketogenic fasting? Probably not.
I'd have to say something about that.
Yeah, fast mimicking fasting. We're going to talk about a lot of things, but we have a special guest here today. And Maureen, can you give an introduction to Dr. Michael Klaper?
I would love to. It's such a pleasure to be here with you, Dr. Klaper. Michael Klaper, MD, is a graduate of the University of Illinois College of Medicine and received postgraduate training in internal medicine, surgery, anesthesiology, and orthopedics at the University of British Columbia, teaching hospitals in Vancouver and obstetrics at the University of California at San Francisco. He's practiced acute care medicine in Hawaii, Canada, California, Florida, and New Zealand. Oh, nice. Dr. Klaper focuses on health promoting food and lifestyle choices to help people prevent the need for hospitalization and surgery. He's authored numerous articles on plant-based nutrition and has been featured in several films, including the award-winning Diet for a New America, What the Health, and Cowspiracy. A longtime radio host and a pilot, Dr. Klaper has served as nutrition advisor to NASA's programs for space colonists on the Moon and Mars. That's very interesting. Dr. Klaper adopted a plant-based diet in 1981 and has helped thousands of patients with diet and use of fasting. Thank you. Welcome to the program.
Thank you very much for that kind introduction.
So let's start off with the simple question is, what is fasting?
Well, it's a simple question.
It's loaded.
The answer is not quite so simple, but in a way it is. The body is so wise and so elegant. And if we turn the clock back 1,000,000 years ago, literally back to our ancient tribal gathering, foraging ancestors on the African savanna, one can imagine there were many times when by the next berry bush with fruit on it might be 5 days away. You had no choice. There was just nothing to eat for a few days until you found the next edible something laying on the ground or hanging from a tree. And actually what we now faddishly call intermittent fasting was probably the rule for our ancient bodies. And we just had to shift into this gear where you drank water and that was it. Until the next time you could get some calories in. And this ancient pattern of drawing on your own energy reserves when there's none coming in from the outside is really imprinted in our tissues. Our entire body knows how to do this. Apparently, chimpanzees can't fast. They can't run on ketones like we can. But we've got this special ability that lets us go for many days without taking in calories from the outside. And during this time, when one is consuming water only, I'm not an advocate of so-called dry fasting. That's a dangerous thing to do as far as your kidneys go and other organs that need fluids. But on a water-only fast, after the first 48 hours, you burn through your blood sugar, your body knows something's up, and it shifts into this gear of conservation, which we'll go into, I'm sure, during our discussion. Now, where it gets very, very efficient. And it starts holding on to calories. It turns down wasteful energy-using reactions like inflammation, turns them right off. Cancer growth turns them off. We'll talk about that. And it gets into this remarkable state of very efficient hormonal balance. Your thyroid function goes down. Your body is just kind of hunkering down and drawing in this state. And at the same time, wonderful things are also happening in your cells. The body is looking for molecules to burn, to throw into the metabolic furnace. So if there's scrap carbohydrates or protein fragments around, it'll grab them and clean out the cells. The process is called autophagy, A-U-T-O-P-H-A-G-Y, eating yourself, as the word says. And so you wind up cleaning your cells on a cellular level. It's a remarkable state. When you start eating again within about 48, 72 hours, when the body's convinced, okay, we're not starving, then these remarkable conditions start to recede. But so water-only fasting is maintaining this state of conservation, cell renewal, of energy, parsimony, for as many days as possible while you're running on your internal fat stores. Most folks with normal fat stores, not great obese people, but normal folks we have a significant amount of fat in our abdominal cavity wrapped around our intestines. And so the average human man or woman can easily run good 60 to 80 days, just on their internal fat stores, fat under the skin, before dire things start to happen. So I have to laugh when I see these survivor shows. They dump these He-Men out in the wilderness, and within a day or so, they're, got to get some protein. I'm starving to death. I got to bite the head off a lizard. Whoa, yeah. And the truth is, if they would just find a stream and build a little shelter and sit down and sip water, they could go for weeks on just water. It doesn't make for very exciting television, but that whole idea, we got to keep eating there, is really not necessary, because their body looks after us in that way. So fasting is staying in this remarkable state of cellular parsimony, of stinginess of burning energy, and cellular renewal for X number of days. As little as 2 or 3 days, 48, 72 hours is worthwhile doing. But again, where I worked at True North Health Center, when people came in with serious diseases, runaway hypertension, diabetes, inflamed joints, these folks routinely did 3, 4, 5 week fast. And boy, those joints cool off, blood pressure comes down. We'll talk about the clinical effects. So there's medical therapeutic fasting for these official disease states, but there's just renewal fast that people can do at home, 3 days at home, or up to 5. If you're a healthy person, you can do up to 5 days on water at home. And it does a wonderful thing for your body to shift into this wonderful renewal gear. So that's just a quick snapshot of how I view fasting.
So let's start off with the simple fasting you're talking about. So you said the average person that doesn't have any chronic medical diseases like diabetes or heart disease, we'll talk about it in a minute. How would you just introduce them into starting to do a fast? Because when I was looking up, I did some research, and there's like the crescendo method, there's a 5-2 diet, there's a 16-8 method. It makes it sound very complicated, and I'm like, and it must be like, well, you're just like, you have some water and, not eat. What would be the best way for the average person to slowly, like, either, ease into it or ease out of it? What was the recommendation to start a fast?
Okay, very important question. Okay, first of all, realize how abnormal our current state of nutrition is. Not only what we eat, all the burgers and the buffalo wings and the pizzas and all this pathogenic food stream we keep pouring through our tissues, but it's when we are constantly eating. Eating has become a recreational activity in this country, and you drive down any busy street and there's burgers and fries and buffalo wings screaming at you from the signs and the windows there. So we eat all the time. This is an abnormal thing for us to do, to stay in the constantly fed state. So anytime you can take a break from that, let your body clear out, let all that fat and protein and oils and sugars clear out of your bloodstream. It's a good thing. All your organs rejoice at even 1 day's respite, let alone 2 or 3 days. So know any time that you just do a day or 2 or 3 on water, you're doing a good thing for your body. Now, that said, people, oh my God, I get hungry when I miss lunch. You're telling me to go 2 daes without food, 3 days without food?
Even 2 hours.
2 hours? Are you kidding? I work, of course, and some people go weeks without food. So what's up with that? Well, again, the body and Mother Nature, they really take care of us. It turns out that, as I said, you burn through your blood sugar and some sugar in your liver stored as glycogen for the first 24, 48 hours. After that, you start burning fat tissue. And when that happens, molecules called ketones come into the bloodstream. They're the fragments of the fat that's being burned, these long-chain fatty acids. And ketones have a number of effects, which we'll talk about, but one of which is they suppress hunger. And the vast majority of folks who do a fast, by day 3, 4, you're not hungry anymore. It's God's gift to fasters. You don't spend 21 days hungry on a long water fast there. So first of all, when people are considering going without food, it's only for a day or so. Nothing bad's going to happen. Your stomach may growl a little bit. Drink more water. Go out for a walk. Relax. It's just hunger, and it'll pass. Keep your tummy full of water. Keep those stomach walls distended, and the hunger, isn't terrible. And as the hours go by, especially as the days go by, if you do a 4 or 5 day fast, hunger drops out of the picture. So first of all, relax. You'll make it through just fine. All of us, as I said, have a 2-month supply of fat on our tissues to burn. Nothing bad's going to happen if you go 48 hours without solid food. There's if you're really skittish about the subject and don't know how to start, there's no hurry here. There's no emergency. One thing to do would be to and pick like every other weekend. Pick 48 or 72-hour period, and first time just do a juice cleanse. Just drink fresh vegetable juices, mostly green juices, not a lot of fruit in it, green juices. And you notice I use the word juice cleanse, not a juice fast. There is no such thing as a juice fast, really. These vegetable and fruit juices have calories, and they're usually a 600-calorie liquid diet, and you don't go into ketosis. But it's a wonderful thing to do. Juice cleanses are wonderful. They flush all those phytonutrients through your cells. It's a wonderful thing to do. And that's just to show you can get through a weekend with no solid food. Just drink, sip, and you don't chug a lot of these juices. You take a mouthful, put the glass down, chew it up, mix with your saliva, swallow it, wait 5 minutes. Let it get down into your stomach, out into your tubes, and do it again. We get absorbed. There's nothing physiologic about dumping 16 ounces of potassium and fructose-rich liquid into your stomach.
So Dr. Klaper, hold that thought right now. We're going to be right back after the short messages from our sponsors, and we'll be back talking more with Dr. Klaper about fasting, different types of fasting, and how it can help you take back your health.
Clear?
All right, everybody, here we're on Facebook Live. Thanks for joining us. It's already been a great start of a discussion here with Dr. Michael Klaper. Everybody who's seen any of these movies like What the Health, Cowspiracy, Diet for a New America, he's been doing it the longest and probably the most with most patients in the clinics, in a clinical setting, treating thousands of patients every year when he was in practice doing this actively, teaching fasting to patients that actually had medical conditions, which we'll talk about when we come back after the break here. But it's a great thing. I want you to start sharing this video. The other thing is I want everybody who's listening to go to sanjevani.net and sign up for our newsletter, because we will be moving our show to a different time and maybe a different place and a different segment. So you want to make sure that you follow us there. So go to Sanjevani, SANJEVANI.net, and sign up for the newsletter. And also you want to go to our YouTube channel and subscribe, House of Sanjevani on YouTube. And this will pop up in your feed. You can listen to and watch all the episodes that we've had with wonderful, wonderful speakers and doctors, scientists, and patients who have overcome chronic illnesses just through lifestyle changes. So we've been talking about fasting, and one of the things that I'm always interested in is that you're talking about drinking the water. I'll bring this up when we start with this segment, Dr. Klaper. But is there a certain amount that they should be drinking? Because since we're not eating, or just normal hydration, about half your weight in ounces, or is there a rule of thumb, or just keep the belly kind of full? When you get hungry, just drink a little bit more. What's the way to ease into that? Because most people will freak out. They'll say, by dinner I'm starving. How's the easiest way to calm that hunger down?
Sure. Well, certainly drinking an ample amount of water. We tell people, listen to your thirst plus one more glass. You don't want to get dry or thirsty in any way, shape, or form. So just keep sipping that water. One thing that works very well, I found during my last fast was very helpful, was sparkling water, was carbonated water. It's satisfying to consume, and it's more filling in the stomach, and some folks put one drop of lemon juice in there, but sparkling water is a wonderful, very satisfying way to water fast. It really takes the edge off the hunger. So that's something to do. Otherwise, just keep sipping that water, but don't go overboard. We've had folks, I got to do a 16-ounce glass of water every hour. Don't do that. You get water intoxicated doing that.
It doesn't have to be alkaline water or any special type of water.
Any pure water will do. Any pure water will do. Distilled or purified, not a problem. Okay. Are we coming back?
We're coming back.
Okay.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
So we're talking about fasting with Dr. Klaper, but before we get into the discussion, he was talking about juicing and then slowly get into water fasting. We just want to let know our listeners is that we got a tally today. We have about 72,000 people who have listened to our show around the world. So we want to thank you very much for that. And for that thanks, we also need to inform you that this show might be moving to a different time and place. So in order to keep up with watching this show, listening to this show, you want to go to sanjevani.net. That's www.sanjevani, spelled SANJEVANI.net, sanjevani.net, and subscribe or sign up for our newsletter. And also go to the YouTube channel, House of Sanjevani, and then subscribe to that. You want to follow us because we're going to be moving to a different time and place. We're still going to be shooting the live Facebook feeds, but at different times. And also the radio show will be posted as a podcast or potentially on a different type of platform. So please go in, sign up. Now, Dr. Klaper, you were talking about juicing in the beginning. There's no such thing as a juice fast because you're actually getting calories, but it's a slow way to move into kind of taking it.
Right.
And then we're talking about water. You said, oh, a little bit of sparkling water, maybe a little bit of lemon, something to help with a little bit of hunger, but not overdo the water. Just one glass of water plus one extra one.
Exactly right. Keep your thirst under control. Don't get thirsty. And then, so after you do the weekend on juices, and these are basically green juices with a little bit of carrot or apple, so it doesn't take like long clippings, but just but they're mostly green juice. These are not fruit juices. These are green juices, vegetable juices. After you made a weekend through on juices, then you can go to vegetable broth, which is a lovely thing to do. You can make it yourself. Just throw a bunch of leafy greens and potatoes and things in a pot and just boil them overnight till it falls apart and strain off the water. Use that as vegetable broth. But you can buy low sodium vegetable broth at the store, and Trader Joe's and Whole Foods, they sell that. And just sipping vegetable broth through the week. There's no calories in it for a day or two or three. Now you're a little further along towards pure water fasting. And once you realize you can survive on juices and vegetable broth, then you're ready for 24, 48, 72 hours on water. And you'll find it's not such a terrible ordeal. It may be hungry for the first day or so, maybe a little growly, but just keep drinking the sparkling water, you'll be fine. And then as you continue, you can go, if you're healthy and you're feeling good, up to 5 days more. And this assumes that you're not on medications. You're basically a healthy person. If you've got type 1 diabetes, you shouldn't be fasting. You've got kidney problems, you shouldn't be water fasting. There are certain medical concerns here that makes this not for 100% for everyone. But if you're basically a healthy person, you're not on medications, then you can do up to 5 days at home. And if you do longer than that, you ought to be at a place like True North Health Center in California, where there's people who know how to look after you on these long fasts, because people can get lightheaded, you can get nausea, you start vomiting. You want people around on these long fasts who know what they're doing. But 5 days is safe for most everybody at home.
So we see a variety of patients in our clinic, from the standard primary care, like diabetes, obesity, hypertension, and, a lot of our patients have cancer. So can you address, like, what would you do with, let's say, most of the patients, type 2 diabetics coming in, and they're like, oh, they're taking a medication, and they're always, they're always they are hungry, they're trying to get their A1C down, moving them towards a plant-based diet, or even cancer patients, they might be on the opposite side where they might be underweight, right? And we know that the data shows that, some intermittent fasting prior to even sometimes the treatments have been shown to upregulate immune system. How would you approach these two types of patients? Let's start off with the diabetes, or someone who's just a little bit overweight, have a blood sugar, maybe a little blood pressure problem. How would you do that differently than someone, say, on the cancer side?
Sure. Oh, important question. Well phrased. Okay, as far as our fellow who's a bit overweight, you've got high blood pressure and type 2 diabetes, he'd be ideal for a water fast. But the issue about medications, we're not trying to be too compulsive, but the problem is that on a water fast, medications get potentiated. They become more powerful. They are less bound to albumin and other molecules that you tie them up, and there's more free drug available. And so you start getting side effects. You don't want to do a water fast on these powerful high blood pressure pills. They'll drop your blood pressure to your boots. You don't want to do water fasting on insulin. You'll wind up with way low blood sugar. So you got to be a little careful. But if you're on thyroid medication, you cut it in half for the time that you're on water. As far as that type 2 diabetic person, if I were working up at True North, I worked there for 8 years. I supervised several thousand fasts over those 8 years up at True North Health Center. And if this gentleman came in, I'd say, oh boy, he's a great candidate for water fast. We would instruct him how it's done. And then what we would do, because we're medically trained, is we would probably stop his medications, so stop his metformin, and unless he had runaway high blood pressure, taper down or stop his blood pressure pills. But we're docs, and so twice a day we knock on his door, check his blood pressure, stick his finger, what's the blood sugar doing? We're watching this person to see what happens. And an experienced person, could do something like that at home. But if you got medical issues, it's a bit of a consideration. You want people around, at least checking in. Have a nurse drop in, check your blood pressure, make sure your vital signs are okay. Knowing that we can do long water fasts up at True North, I know if this man stays on his water fast, as the days, especially weeks go by, that blood pressure is going to march on downhill. And that blood sugar will get easier to control. I don't want to get too much in the woods here. I expected type 2 diabetic persons to, have a big fall in their blood sugar. It doesn't usually happen. And the reason why is the body, again, is so smart. Your red blood cells that carry oxygen need sugar in the blood. They can't run on ketones. You got to have sugar in the blood. And if there's very little sugar that's being made from a little bit of protein, a little bit of fat that the liver's putting out to keep your red cells alive, the body doesn't want to burn that into your big muscles. They can burn ketones. So the body in its wisdom, when there's fat being burned in the blood, it makes the muscles insulin resistant. And so it keeps the sugar out in the bloodstream. And it's a brilliant mechanism. But meanwhile, those sugars stay at 140 and 150, and it frustrates everybody. Doesn't matter. Because what I really want to get here to the audience, Dr. Pai, is I'll be glad to talk about all the wonderful things that happen during fasting, especially with the cancer patients. But for everyone to understand, no one really needs to water fast, with rare exceptions. The issue is what you eat after the fast. It's
right.
The food stream day after day, month after month, year after year, pouring through your tissues. That creates either a lean, healthy body, if you're eating a whole plant food diet, or one that's obese and clogged up and hypertensive and diabetic from the meat and dairy and processed food diet. And if you just eat the whole food plant-based diet, you wind up, as the weeks go by, in the same place if you had done a fast there. Those blood pressures will eventually come down, the diabetes eventually goes away. So the fast is kind of a jump start to getting control of these conditions. But it really is a stepping off place to a whole food plant-based diet. Because if you go back to the chicken and cheese and olive oil, it all gets undone within days. It's shocking how quickly the blood pressure goes back up and the diabetes gets out of control, the joints start hurting again. The fast is just a starting point to a whole food plant-based diet. That's really where the key should be. And so during this time where a hypertensive diabetic man is fasting, we're sending him down to cooking classes and showing him how to shop and to make soups at home and how to put together a salad. So when he's through fasting, he can continue on a diet that will keep these good changes that started during the fast, keep it going as the weeks and months go by and turn him into a really healthy person. So the fast is magic, but that much magic, okay? It's the real magic is in the whole food plant-based diet that you eat after the fast. Now, what about the cancer patient? Does fasting have any role in cancer? Well, it sure does. Very interesting. Dr. Walter Longo down at the University of California, Southern California, was fasting. He was doing studies on rats that spontaneously developed cancer. And he was giving them all chemotherapy to see who would respond the best. And when he found out when he fasted the rats, boy, they got this tremendously exaggerated good response to the chemotherapy. And so much so, they didn't use the chemo, just fasted them, and the tumors stopped growing. And he said, how can this be? Well, it turns out the body, again, it's so wise. If it knows that if it thinks it's starving to death, every calorie is precious to keep your heart going, to keep your nerves firing. It doesn't want to waste energy on useless reactions, one of which is inflammation, turns off inflammatory reactions. And so those hot joints cool off, the psoriatic skin goes away, the asthmatic lungs clear out. remarkable anti-inflammatory effects on a water fast, dear to your heart, sir, with your book. But also, another totally useless reaction if you're starving to death, a total waste of your calories, is running a malignant tumor. And why would the body want to do that? So it turns off cancer growth. How does it do that?
Yes.
Well, it turns out that the body summons up these remarkable molecules called sirtuins, S-I-R-T-U-I-N-S. I had never heard of them, but they are deacetylase inhibitors. They're molecules that keep the tumor suppressor genes going in your cells, and it really shuts down cancer growth. And we see this. Dr. Ornish, when he puts his guys on low-calorie plant-based diet with the prostate cancer, the prostate cancer stopped growing. We've had a couple lymphomas disappear at our clinic. Now, breast cancers can stop growing. Clearly, the fasting puts the brakes on malignant tumors as well. But it's dicey. If the person's already down to 90 pounds, you've got to be really delicate, and maybe just one day every 3 or 4 days, just little drops of fasting to shift into those gears, because within 48 hours, those sirtuin levels start coming up. And so if you can give them even little jolts of sirtuins along the way, and in between, eat a very modest diet. Our paleo friends eating all this meat don't realize that that you eat a lot of meat, your liver responds by putting out IGF-1, insulin growth factor 1, that drives growth all over the body. And so you don't want to do that. In between the days on water, you want a low protein diet, enough to keep weight on you, and fat is okay, avocados are okay. But so I would, for the cancer patient, I would keep them on a moderate protein diet with intermittent fast, like every 3 to 5 days. I would do a day or two on water. And if there was any chemotherapy planned in his future, I would have him go into that round of chemo on day 2 or 3 of a water fast, because like Dr. Longo's rats, he'll probably get a much better response from that as well. So there is a place for water fasting in cancer, but it's got to be used artistically and very delicately by people who know what they're doing.
Yeah, and when I just recently, we'll come back after the short break, but when we talked about cancer, they were talking about the conference. I actually met Dr. Longo, and they were talking about doing this kind of fasting mimicking diet. But really, what they were talking about is like going on a whole food plant-based diet for this short period of time. And I raised, there's like 6,000 doctors. I'm like, why don't we just do that all the time? So anyways.
We do too much.
Yeah, they won't be able to
talked about just going ahead and doing that.
They won't be able to sell you their boxed item foods every month.
Oh, that's
exactly. It's an important topic that we need to start up again after the break.
Yeah, after the break, come back, everybody. Join us again. We'll have this great discussion on fasting with Dr. Klaper.
All right, you're clear.
All right. Yes. It's funny because we were at the, I think it was A4M conference last year, and he was one of the keynote lecturers, and so it was great. I wanted to learn about fasting, and so they're presenting all the data in the rats and the animals and before and after. So I was like, great. But it was like, so I was like, what's so special? He's like, well, because they're on a whole food plant-based diet, and they were trying to sell the concept. Well, do this, 3 or 4 days before, try to do it like 5 days a month or 4 or 5 days a month, and then go back to eating whatever you want. And it didn't make any sense. I'm like, if you're already lowering inflammation, improving immune system function, resting and healing the microbiome within 4 or 5 days of eating this, low calorie plant-based diet, why wouldn't you just go back to a normal calorie plant-based diet and just maintain that whole state? It's because they won't be able to sell you $400 a month box of items.
That box had water, a bar, and what else in it?
It had some some omega, but it wasn't fresh, it wasn't organic, it was just like packaged foods, and I was like, we're trying to do the spin, and everybody was like, oh, our doctors wouldn't think that someone could eat this way continuously. I'm like, well, you haven't given them the opportunity or educated them why they should be eating a plant-based diet. So I was kind of shocked, because I'm like, wow, he did all this great studies, and he's like, oh yeah, go out, eat whatever you want. So everybody's like, oh, well, we can do this like on a weekend and then go to the buffet. I'm like, that kind of just negates this whole concept what you mentioned. You just you're cleansing your temple and then you're trashing it again, and you're like, oh, I don't know about that. So
well, most likely he was not on a plant-based diet.
Right.
He didn't know how to tell anyone how to do that.
Yeah.
If he wasn't on a plant-based diet himself, how is he going to tell anyone?
Exactly.
Great researcher.
Yes. But this fast mimicking diet is a very important topic that we really should touch on when we come back here, because it kind of brings everything together here. How people can do it at home safely, as you're implying here.
Right. And don't let me forget to mention your website and everything at the last segment, so that we can have people to go to. You can go to, actually, listening right now, you can go to Dr. Klaper, DoctorClaper.
Coming back.
K-L-A.
Yeah. K. Sorry. K. Sorry. K. Sorry.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
So we were talking about fasting and how fasting works with cancer patients, and the importance with some of the data showing that fasting prior to chemoradiation therapy, particularly like 3 to 4 days prior, actually had an improvement of the effects of chemotherapy and less side effects, in fact. And so they did it for a couple of days before, and then at least 1 day after the initial onset of therapy. So you were talking about cancer, so I wanted you to continue again talking about your expertise and recommendations.
Sure. We were talking about all these wonderful things that happens in the body when it thinks that no more calories are coming in, how it conserves and cleans out the cells and turns off inflammation and cancer growth. Well, yay, there's a lot of people who'd be interested in that, but they really don't want to go without food, for very long. Well, it turns out that there's a little zone that you can occupy that will let you eat and yet still reap the benefits of fasting, and it's called the so-called fast mimicking diet. And all that we're talking about here is that these wonderful changes that happen when you're drinking water only, well, they also kick in if you drop your calories below 500 calories a day. Well, what does that mean? It means eat salad for a day, okay? And you're just eating raw vegetables or raw salad, maybe a little lemon juice on it. And you can have all the lettuce and raw broccoli you want on that day. And we can talk about, don't eat avocados and sugary carrots and things like that. But tomatoes and lettuce and raw salads, even a pound of that has only 100 calories. So you can eat 2 pounds of salad over the course of the day, and you'll have something in your stomach. You're still chewing and tasting and all that, and yet your body still shifts into pretty much that same fasting gear, and you get these benefits. So doing 3 days on salads, or over a long weekend, lovely thing to do. Or these low sugar vegetable juices. You get good effect out of that, even though you're not in rip-roaring ketosis. You'll get a good benefit from dropping your calories way down. So that's the so-called fast mimicking diet. Finally, people are aware that one time everybody fasts while we're sleeping, and that's why the first meal of the day is called break fast. And during that sleeping time, your body is starting to shift into that fasting gear, and already the early hormonal changes are happening, and thousands of enzymatic changes are happening in the cells. You're not in rip-roaring ketosis, but you're just starting to gear up to that. The body knows there's some changes happening. We do that every night. Well, you wake up in the morning in that brief, just about the official fasting state. The theory now is, well, keep that going all morning. Just because the sun comes up doesn't mean you got to run to the kitchen and shove a bunch of sugar in your mouth. Your body is perfectly happy to keep burning the fat-rich mixture it's been burning all night. So keep that fat burning going all morning till noon. Start your eating day at noon. And even then, just have a salad or some vegetable soup. You don't have to have a whole bunch of sugars and starches and fats. And keep your diet pretty lean, during the day there. But so extending the fasting window to a good 18 hours a day, at least 16 hours a day, you can do, if you say at 6 in the evening, you stop eating, do all your eating between noon and 6. be done with food at 6. You can keep drinking water during the evening hours. And so 6 till 6 in the morning, that's 12 hours. And then another 6 hours till the following noon is 18 hours. You're doing an 18-hour fast every day. During those 6 hours from 12 from noon to 6, boy, let the wonderful plant-based eating happen and have your soups and lentil stews and bean salads and things. Eat, my children, eat. No one's telling you to, this is not, fasting ordeals here. I want you to eat. But if you're trying to get the benefit out of fasting, it's okay to open up this window of no calorie intake on pretty much a daily basis, and you gain great benefits from it.
And Dr. Klaper, what sort of activities do you recommend while doing this? Is it all right to go ahead and do your exercise regime, or can you do yoga?
Thank you, Maureen.
Mm-hmm.
Such an important question for 2 reasons. One, you need to move. Don't lay in bed. People say, I'm going to lay in bed for 21 No, you don't. You get pneumonia.
It'll make you hungry.
No, man, we are meant to move. You got to move. But, and so absolutely, you do some yoga, do some stretching, wonderful. You absolutely should do that. And you can take a gentle walk, maybe around the block, but that's it. This is not the time to do aerobics. This is not the time to go out for a run. Why? Because I mentioned, your blood sugar is going to be dropping to a barely, till in the 50s, 60s, 70s range. You want that sugar in your blood for your red blood cells. Don't go out for the run because you will burn that sugar down and you'll come back with a blood sugar in your boots and hypoglycemic. It's a serious thing. You don't want to do that. So during the fasting time, minimal walks, minimal movement, but yoga and stretching is fine. But this is the aerobics will wait till after the fast. Do not do intense aerobic exercise during a water fast.
And you probably wouldn't want to be going to work like that either.
No, this is a time for you. This is a special time. You put this aside. Well, it's some people do, and I've got people who work while they're fasting. But you're either thinking about food or you're talking with people about it. You're doing physical activity. And after a while, as you mentioned, if you do this for many days, you become less effective. This is a special time. Take a fast not only from food, take a fast from work, take a fast from the internet, take a fast from the news. Take a fast from.
Wow, that sounds great.
Yeah, really. Hey, and so don't go to work unless you absolutely have to. And if you do, just for a day or two on water. Don't do a long water fast and try to work. It's not, the two don't go together.
Now, what about like contraindications or things to worry about, or times where we have to be a little bit more cautious? Say like women with menstrual issues or during their cycle, should they fast before or during, or does that have any role with how their fast works, or they should wait till after the cycle or anything like that?
Wow, fascinating question. Our colleagues in Oriental medicine might have some real strong feelings about this, but from this Western doc's point of view, who's seen thousands of folks come in and fast, never once have I asked a woman, where are you in your cycle? It really doesn't matter. Let's start your water fast. So that's not a contraindication. Okay. But I don't want to go very medical here, but yes, there certainly are contraindications. As I mentioned, there's some medical issues. If you've got poor kidney function, fasting is hard on the kidneys. Your cells are cleaning out all this junk. It comes out of the cells into the bloodstream and it hits the kidneys and kidney filters. And if you're already struggling with kidney function, probably not a wise thing to do. Folks, again, with type 1 diabetes, if you're not making insulin, you really shouldn't be doing a water fast. People with muscular wasting disease, if you've got muscular dystrophy, if you've got ALS, a long fast will turn a healthy person into a muscular dysreg. Boy, you don't want to do this if you already have a neuromuscular disease. So don't do this with. We've had a few MS patients fast, but it's a little spooky there. So there are some medical contraindications, and we also say if you're on medications, you can't stop. As I mentioned, you really want to be able to stop all meds except thyroid, which you drop in half. But if you're on psych meds, if you're on SSRIs and you can't stop those, you shouldn't water fast. You should do a juice cleanse. If you're on prednisone for your long-term asthma or lupus, whatever, you shouldn't really fast on steroids. And so you do a juice cleanse for those folks. So those are the major contraindications. These serious medical conditions involving kidneys, muscles, etc., and medications that you can't stop. Those folks would probably be safer doing juice cleanses instead.
Okay, and I had a question. I had a question with cancer patients before we go to the next break. Is the study showed like a couple days before they initiated, say, of chemo radiation, and then like a day after. This is the fast mimicking data. But when people have a continuous therapy, right? So sometimes people I just get an infusion once a month, every 3 weeks we can kind of preset that time, have them do that before and a little bit after. But if someone's saying, I'm taking, say, an oral chemotherapy or some kind of treatment that is continuous, then would you recommend like every couple of days or how? Because obviously we can't follow this pre and post. It's continuous. So when would you recommend, obviously not to give direct medical advice, but just in general, having someone work with their provider who might be interested or who can follow them, what would be some guidance if someone's getting more of a continuous long-term therapy?
Yeah, no, that's important. I really like what you said, doing the fast going up to the chemo and for the day after. And believe me, with a lot of these chemo treatments, the day after, you want an empty stomach. And it's a smart thing to do regardless, because you'll be a lot less queasy. And your body's dealing with the chemo. It doesn't want to digest a big meal that next day there. So it's a wise thing to keep that fast going, at least for a day or two after the chemo. It's a good thing. Okay, after you said, so what about the continuous folks? You have to get, if you're going to get the benefits of fasting and you're taking the pills every day, then you got to pick your time that it works for you. It depends on the individual person, how robust they are, how comfortable they are feeling fasting. But they could probably, if I had a aggressive cancer or one that really wanted to play fasting here, I do it fairly frequently. I would do it if I was on continuous. I do like a 3 or 4 day fast at least every other week, if not even closer than that. Every 10 days or so, I do 3 days on water, 4 days on water.
Okay. Wonderful there. We'll hold this thought because we'll continue after this short break from our sponsors. So stay tuned.
All right, you're clear.
All right, everybody on Facebook here, thank you for joining us. Wow, this has been I'm learning so much, by the way, and my patients are going to be so excited because they've been asking me all these questions. So I really appreciate you joining us today. We have one more segment to go to, and we'll get into a little bit more specifics. I do also want to ask you, when we're on the air, more importantly, a little bit about your background with the NASA and the advisory and
exactly
the nutrition.
What I just read,
because I want people to hear, like, astronauts are like super smart. They have to be physical and mentally smart and all. What kind of nutrition are these? These I would say Einstein athletes, because they have to have both to be an astronaut. What did you have to educate them or assist them with their diet? Because I think that's when we look at professional athletes. There's a movie I think called Game Changers that's James Cameron just did recently. It's going to be launched probably the end of the year about all the the athletes and the weightlifters and runners and boxers. Everybody's eating this as we call it, the anti-inflammatory diet. And again, everybody, book an Inflammation Nation. Go to inflammationnation.com if you want a copy of that or signed copy. But we're moving this now. When we look at someone like an astronaut, I'm just going to be really curious to see, like, when we come back, what is the discussion? Because a lot of people, what really I think bothers us a lot is that right now with social media, there's so much misinformation every day. It's just not factual, and it's just product driven to say, again, paleo, ketogenic diets, these are the trendy fads again, Atkins in disguise, paleo, keto, and now the data is showing that, even with ketogenic diets, that cancer cells can actually use the ketones for metabolism. We have studies now published 4 years ago that in the animal study, they increased 2.5 times the growth of cancer. So
you are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevni.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
It's been a great discussion so far. I want everybody who's listening, all 72,000 listeners, to go to sanjevani.net and sign up for our newsletter, because our show will be moving to a different time and date, maybe possible different platforms. So please sign up for the newsletter so you can stay in contact, so we can continue listening to these wonderful shows. So today we're talking about fasting with Dr. Klaper. It's been a great discussion. I want to read a couple of quotes real quick. Benjamin Franklin: best of all medicines is resting and fasting. Mahatma Gandhi: a genuine fast cleanses the body, mind, and soul. Hippocrates: food thy medicine, let medicine be thy food, but not to eat when sick is to feed your sickness. And Maureen, you were talking about this morning, what was the quotes that you always talk about?
Starve a fever, feed a cold.
Yeah. So anyways, this is like, it's in our culture so much. It's, some cultures fast for a month and or Sundays. And so I think why we don't hear about it much is because our whole economy is based on consumerism of like, here's your, McDonald's or Starbucks. So no one will make money if you said don't eat for a couple of days. So there's a little bit of lack of understanding why, really it's not formally discussed, because, we sell food all the time and beverage.
Right.
Mm-hmm. Great. Absolutely. One thing before we go on, regarding fasting and cancer, I don't want to get people's hopes up here inappropriately. Not every cancer responds to fasting. And we'll notice that the tumors that do respond, the prostate cancer, breast cancer, these are hormone-driven cancers. And surely the fasting state changes estrogen receptors and does things that really slows down these hormone-driven cancers. But I've had a couple of patients, one with a kidney cancer, fasted through a long fast, didn't slow it down at all. And some of these nasty sarcomas and things are really solid, hard tumors. That's asking a lot of fasting. So it's not a panacea of, I'll just fast and make my cancer go away. It's one tool that you use to help yourself get healthier inside and out, your diet, your medications, rest, all the things that a good practitioner will guide you through. So don't want to build up false hopes regarding the fasting therapy.
Yeah, and the idea is that, what we understand with the evidence-based medicine is that there's different 7 epigenetic factors that people follow: diet, lifestyle, environment, belief system, etc. So the diet's always the utmost. Like if they're not plant-based, then we're always trying to improve the outcome. Obviously, everybody's different, and some cancers, some diseases are just really stubborn, and people need to work on. But there's more than just diet. But if they don't fix the diet, then we can't expect these great outcomes that people are saying. And also just doing it for a couple of days and then going back to the standard American diet is also cheating themselves from the outcome. Now I want to switch in this last segment because with your history, we've met a couple of times at the Peapod conferences. Everybody, Dr. Klaper, go to drklaper.com with a K, DOCTORKLAPER.com, and you can look at his videos. He's got all sorts of wonderful things and DVDs, and go and learn more from him. But part of your background, you were a nutrition advisor for NASA and the moon and space colonists. Can you explain a little bit to that? Because I'm really interested in understanding, what do astronauts eat, or what did you advise NASA with their astronauts?
So fascinating.
Sure. Right. Well, it's amazing how so much of the world is pointing us to plant-based diets. And even NASA wound up looking at the same conclusion in this manner. This was way back in 1987. I had written a small book on vegan nutrition, on plant-based nutrition. It was a booklet almost. And the year before, 1986. Well, it's 1987. NASA is trying to, they're figuring out how to get long-term space colonists on the moon and on Mars to live there long-term, more than just to visit. They're true colonists. Well, it turns out the physics and the economics of space travel is that to rocket anything, even into low Earth orbit, costs $16,000 a pound of anything, okay? Well, it didn't take NASA long to realize they're probably, to feed their astronauts, not going to be rocketing 700-pound dairy cows and 80-pound bales of hay up to the moon. That's very expensive yogurt. And it dawned on them that their astronauts are going to have to grow their own food. They're going to have to be, dare I say the word, vegan. And they had no idea what to feed a vegan astronaut. They didn't even know if it was possible. Well, by luck, one of the engineers, somebody got a hold of my little book on vegan nutrition. And I went through it. And I get a phone call from the Johnson Space Center down in Houston. It's Dr. Klaper. It seems you know something about living on plants. Would you like to come on down and spend a week or two with us and talk to us about feeding human beings on plants? And I said, sure. So they flew me down to Houston, and I spent a couple of weeks at the Johnson Space Center and worked with their engineers and their nutritionists and their dietitians, and we did all the calculations for how much protein you can get out of lentils and beans and sweet potatoes, and did the actual grunt work of figuring, you know, what would it take to feed a human being, grow enough calories and enough protein, amino acids to keep them healthy. And we did it. Yeah, it's doable. But you've got to be a real industrious, well thought out plant-based person with the right equipment. But it's doable. And so after a couple of weeks, they got the idea. I left all of them that I could impart, and went on my way. Though I stayed in touch with them for several months afterwards. And now I see they're growing the sprouts and lettuce up on the International Space Station, and Matt Damon's growing potatoes on Mars there.
Right.
And when I saw that movie, I said, I know exactly how and what he's doing there. And every time the space station goes over, I wave and I enjoy your lettuce up there. And so they go out in a whole, way direction beyond where I left them. But that was my interaction with NASA, and
which is
and
a
good
great
for them. They accepted plant-based nutrition.
Right, because remember, I just want to remind the listeners is that, remember, plant-based food not only has protein, right, plants have protein, but it also has antioxidants, phytonutrients, and fiber, and animal protein is lacking to the other three. And so that's where, when you look at the density of something to ship up, you want to send nutrient-dense foods that contain all the categories rather than like a dehydrated fried chicken or whatever it is in space. It probably wouldn't make economical sense. So I really enjoy that story because this is something that people need to understand, that athletes, and now we're talking about astronauts, everybody's moving towards this plant-based diet because we have to look at inflammation, we have to look at nutrition and feeding ourselves, although it's different than most people are used to, but now we have to look at even sometimes not eating can be helping in healing.
Mm-hmm. Well said.
So, Maureen, any questions before we finish this segment?
Well, I just wanted to ask one more thing. When cancer patients are fasting, is their immune system kicking in to a higher gear?
Yes. Oh, absolutely. Good question. Yes, it certainly seems to be so. And I imagine the immunologists could talk about improved phagocytosis, eating the white cells, eat up germs better, etc. But what we definitely notice, a lot of people would come up to True North after surgery for healing, and boy, wounds heal really good on water fast. You're counterintuitive. But infections seem to clear up very well. We've rarely had people get an infection of any type during a water fast. So clearly, when the animals are sick, they curl up under a tree and they don't eat for a few days. And during this time, surely, if they've been in a fight and there's a wound, their immune system kicks up to heal them. And surely we have that same power as well. So I haven't seen a lot of actual quantitative documentation of how the immune system does it. But I'll bet your immune globulins go up. I'll bet your white cells eat up germs better. I'll bet absolutely our immune system is elevated in function during a water fast.
Okay, so everybody, I think the show just finished, so it's okay. But we're going to continue this discussion because we have time. We're here on Facebook Live, so continue on because this is a great discussion. I enjoy. We know the upregulation.
Still need to close the show.
Oh, okay, everybody. So we're still live. So, anyways, I want to thank our special guest, Dr. Klaper here. Go to drklaper.com. Take a look at his website. Again, go to sangevany.net. Sign up for our newsletter because we will be moving our show to a different time and place. And so we want you to continue to follow us, all 72,000 people that have listened to our show. Thank you very much from the bottom of our hearts. It's been a great run here. And we want to continue this run just on a different level so we don't have sometimes so much technical difficulties. And thank you very much for support. Go to sangevany.net, sign up for the newsletter, and go to inflammationnation.com for a signed copy of this book. And thank you very much for listening. Best of health, everybody.
All right, you're clear.
All right, everybody, here we're on Facebook Live. So let's continue this discussion again. So we're talking about the immune system upregulating and people not getting sick. And you were mentioning this great analogy that animals, like when our dog's not feeling well, what does it do? It eats grass and then it doesn't eat much at all.
Right.
Exactly. The animals know.
Animals
And
know,
we should
right?
follow their example. Sure. Yes. Right.
And sometimes, we get pushed, culturally. I think it's just like, oh, you're not feeling well, eat more, eat more, eat more,
Yeah.
and from the right intention, right
It
intention.
comes from love.
Yeah.
You're right. Mother wants the best for you. But the truth is, Mom, I'm not hungry, and I think I just want to drink water this afternoon. That's a good answer. Yeah.
We need to make a product called Mom's Water. Then everybody's feeling like gonna hurt. Right? It's trademarking right now.
That'd be a good idea. I'll split the profits with you. It helps both moms and the kids. It's great. Everybody wins.
So, Maureen, any questions you have? I think we covered diabetes. We covered now lipids. So we also know that the cholesterol gets lower. We know the lipids get lower. The A1C gets lower, the blood sugar at 3-month level. We know that the inflammatory markers get better on the fasting. So let me ask you this. With most of our patients that we're moving plant-based in our practice, but everybody still has, a couple of pounds. Everybody wants to always just lose a little bit more of the abdominal weight. You were talking about, more of the obese diabetics. They have a little bit more to burn. But just doing a periodic fast here and there, that would probably be one of the simplest ways, if they're already plant-based, to kind of accelerate with that weight loss.
Well, if you are already eating a whole plant-based diet,
right,
and you still got a significant belly pooch there,
right,
you're eating too much flour and oil. And stop all flour products, stop all refined oils. Eat whole, the term is whole food plant-based diet. Eat things that grow out of the garden. So everybody should be lean. If you're eating plant-based, you ought to pretty much have a flat belly, period. If you're not, then you're eating something that you shouldn't. Fasting is not for weight loss. People who fast to lose weight wind up disappointed because as soon as you start eating, most of that weight comes right back. That's not what really the fasting is about. Fasting happens, weight loss happens long-term with soups and salads and greens and veggies. That's how you create a lean, healthy body. I do want to correct you. It turns out that during the fast, and this is only an acute phenomenon during the water fast, but the truth is your fat cells are full of cholesterol. And as you start burning fats and emptying out drawing down your fat stores in your fat cells, that cholesterol comes into circulation. And it's common on a water fast for cholesterols to go up to 230, 240 on a water fast. Oh. It's a temporary surge just because you're emptying out your fat cells. But when I first got to True North, Dr. Goldhammer says, if you can, you got to, once a week, you got to draw electrolytes, see what the kidney function and potassium's doing. But that's about it. If you can avoid, don't draw any other bloods on a water fast. The lipids go cattywampus, liver enzymes go up on a fast, uric acid goes up on a fast, and it just freaks the doctor out, the patient. It's not important. Make sure the potassium in their creatinine stays okay and fast on, but don't expect magic things to happen. As I mentioned, blood sugars can stay stubbornly high, so do lipids. Again, that comes down month after month after month on a plant-based diet. It's how you get your lipids down. But fasting it's a strange state there.
With people on using the water fast to monitor their electrolytes, aside of just checking the blood work, should they be taking drinking like coconut water every once in a while to add a little bit more minerals or anything like that, or just no, that's not even really necessary?
Lots of sugar in that, right?
If you got healthy kidneys, your sugar in the coconut water that would break a good chance would break the ketosis. But you got healthy kidneys. They know how to hold on to potassium. They know how to hold on to sodium, and so there's no real need to be drinking electrolytes and all that stuff. There's plenty of time for that. And a lot of it in your blood already.
Okay, awesome.
Love that idea. Okay. Everything you need is within you.
Really, really. By the way, yes, isn't it? How nature, this body is. The more I learn about it, the more
it's almost too simple to be true, right? It's like just like with all these foods behind us, like the food is medicine. It's like, really? Are you sure? Like, are we missing something? Like, no,
yes,
it is.
Stunning. Really, doctors should know this.
And I want to.
Sorry,
I want to just invite everybody who's listening. There's an annual conference that sometimes Dr. Klaper goes to. It's called the P-Pod, pod.org. It's a prevention of prevention of disease on plant-based
Plant-based
diets.
plant-based prevention of disease. Right.
Yeah, and so it's going to be next year, I believe, in North Carolina. Just take a look at it. It's for the public to come. It's really inexpensive. It's a great way to meet people like Dr. Klaper, like myself, like all these wonderful people like Milton Mills that we had recently on the show, and all these wonderful people from PCRM and all these other nutritional organizations, and actually hear the science directly. It was like 2-3 days of just hardcore, just lectures that the layman can go and learn. And it's like, wow, this is not social media, this is not talking heads, this is what you can do to really take back your health. And here's the data. It's evidence-based that we always want to be following.
And I think we have to constantly be educating ourselves and learning new things, because there's constantly, new changes in the channel. So I became a vegetarian when I was 12, and, I've been vegan now for 10 years, but I'm constantly educating myself because there's new things, new information. There's always new recipes, of course. So educating yourself continuously is very important when you go to a plant-based diet.
Yes, I couldn't agree more. I'm a student of medicine myself. I'm a medical student, and I'll stay one to the last day on this planet. By the way, you might be interested. That saying that Hippocrates said, let food be your medicine and medicine be thy food. Everybody talks about it. But the second half of that, let food be your medicine, that makes sense. Let medicine be thy food. What are you talking? You're eating bottles of pills. What are you talking about? That part never made sense to me until I worked at True North and I saw the power of foods to heal tissues and heal diseases of all types, high blood pressure, diabetes, etc. And then it dawned on me that if you're someone with active lupus, someone with rheumatoid arthritis, someone with high blood pressure, that's medicine for me. That plate of kale, that's medicine for me. And that's medicine for me. And your food, because the medicine is your food. And each one heals you. Meal after meal heals you. Let medicine be your food. And of course, it's the food, it's the vegetables and the fruits. But it dawned on me what he was saying with that second phrase, the second part of the phrase there. Let medicine be your food. Your food becomes the medicine, and you should take it into your body. This is going to heal me. That's going to heal me. And take it in as let medicine be your food.
Yeah, we always tell our patients that food should be coming from the pharmacy with an F, F-A-R-macy.
With an F, very good.
So that's
and there's a lot of foods that grow wild that are medicines that, people are out there spraying with Roundup. Stop doing that. Start eating those things, dandelions and purslane and all those wonderful things. Yeah.
Delicious.
So what are you doing now? So now that after the True North and everything, what are you doing now on the next phase of your journey in life?
Absolutely, very important question. As much as I enjoyed my 8 years up at True North, seeing people one at a time, it just got too slow. We need bigger changes more rapidly.
Right.
And the place that has to happen is in the medical schools. I want to reach the young medical students before pharmacosclerosis sets in. To tell them, listen, you're going to spend your career. You're going to spend your career treating high blood pressure, diabetes, obesity, and the textbooks are going to tell you these are chronic diseases. There's no cure. Nonsense. These are all curable diseases. It's from what your patients are eating. And before you order another $1,000 scan, another $500 blood test, stop. Ask your patients what they ate yesterday. Mm-hmm. And if out comes the litany of burgers and buffalo wings and pizzas, stop. Everything you need to know. Send this patient to the plant-based dietitian down the hall. Let Ms. Smith talk to her about what that patient really ought to be eating. See them back in a couple of weeks and see if that blood pressure is lower, see if that leg is less blue, see if that patient's getting healthier, because they will be. And so PCRM, Physicians Committee for Responsible Medicine, been sending me around to medical schools, talking to the first, second, and third year med students. And I stand up there and I say, I sat in those chairs 50 years ago, 1968. I was a first year med student. And I was, and I told them, I'm going to give you the lecture I wish somebody had given me 50 years ago. That listen, these are not unknown diseases. It's primarily what your patients are eating. That's square one. Clean that up, and most of these diseases go away. You need to know that. Your professors aren't going to tell you. Your books aren't going to tell you. I've been in the trenches for 40 years. I'll tell you, these diseases are all curable. and I give them resources about where to learn about plant-based nutrition. And I said, if someone had told me this when I was starting med school, it would have changed the course of my entire medical career. Would have changed every diagnosis I made, would have changed every treatment plan I recommended.
Yes.
I would have become a plant-based doctor, really healing people, instead of an ER doc just patching up the casualties. And you folks need to know this. This is the new era that's dawning. We are required to share this information with our patients. So the Code of Ethics in AMA says we must inform our patients of the latest advances in medicine. It's unethical to withhold this information. Doctor means teacher. Now, we need to teach our patients what to eat, and most of these diseases get better, and you need to know that. So I'm going to be doing online courses for practicing physicians and medical students on applied clinical plant-based nutrition. I'm also going to do a plant-based course. It's going to be the master class in healing with Dr. Klaper and for the public on how to heal yourself from everything from bronchitis to gastroenteritis using natural means. And I'll probably do an online Q&A. I'm really getting some great ideas from you, Dr. Pai, about this wonderful broadcast and how to do something like this once a week. So I'm going to be switching to medical educating my young colleagues, as well as educating the public online. So that's going to be where my focus is for the next few years.
Wow, that's amazing.
So happy. And the production of food will not change until groups of doctors are saying, no more, you're not going to feed us this stuff anymore. And we're having new prescription pads that are going to be plant-based prescription pads.
Yes, and there certainly are. The Plantrition Project has exactly that. They have plant-based prescription pads. But as I speak, sometimes a tone of anger comes out. I'm furious with my profession for scientists who can recognize a genetic mismatch on gene A21 on chromosome 14. That they can identify. But the thought that cheeseburgers and pepperoni pizzas might be making their patients fat and say, ooh, this is too much for them to understand. Well, that can't stand any longer. That's outrageous. And for doctors to be practicing medicine like what our patients are eating has no effect on these diseases.
I know. We hear that every day. Patients are like, the doctor says, eat whatever you want, take the chemo. Eat whatever you want, take the insulin. And I always, I started bankrupt. Yeah, and
have some chemo, and here's some candy, or have a lollipop on your way out. What?
Take your statins, and then keep eating your burgers and your pizzas. As long as you take your statins, keep that LDL down. How bankrupt is that? How corrupt is that? That's got to stop.
What I always say is that, especially since the data came out, and now when I talk to my patients, I said, it's no longer, it's a fact. It's not like an argument or a debate. It's fact. And so we should be eating plant-based. That's where all the science will be. There's no study that will show animal protein will prevent, reverse, or treat a disease. There's just not. Okay, there might be comparative studies on one bad cheeseburger led to one less cheeseburger to 2 cheeseburgers, but not to a plant-based diet because the data won't stand. But what I always tell my patients now is that since the data is so overwhelmingly in this camp, that if the doctor's not, I would say within 5 years, that a physician that does not tell their patient to be plant-based, they could be held complicit in liability for continuing their patient's disease. Because just like if you tell a patient, keep smoking, that's a liability because we know that smoking causes cancer. Now that we know that the animal protein diet, high sugar diet, the standard American diet causes these diseases, and there's all this data, there's no reason why a doctor should ever say that food does not play a role. And if they do, then they're complicit, I believe, in their patient's disease.
Oh, I couldn't agree more. I think it's just a matter of time before some angry widow walks into the office of a cardiologist or a cardiothoracic surgeon, says, my husband died on that operating table last month during a 4-vessel coronary artery bypass, and nobody told us that he could have melted those plaques out of his arteries with a plant-based diet. When did you people know this? Why didn't somebody tell us this? How long has this been in the medical literature? 30 years. Why was this information withheld from us? And she's going to lodge a wrongful death suit, and she'll win that suit because there's no reason to do that procedure until the patient has 6 months of a whole food plant-based diet.
Right.
to even think about doing anything like that kind of procedure. I totally agree with you. It's going to be malpractice not
Yeah.
to.
Every week we get things in the mail, right? From like, CME courses and lectures and things, and so I keep these and I show my patients. So like we had two last week. One was from a cardiologist and he's like, oh, they're celebrating their office practice, blah, 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 so many years in business. And it's like, come meet the doctor at this, it's like a breakfast, celebrate annual celebration. And it was like, come join the cardiologist. He'll be making eggs, bacon, all this stuff. And you're like, the cardiologist is serving this. And this, it was just like, repeat business. And then I got another one just day before yesterday. It was like, oh, learn about something about, it was like kidney disease and hypertension, blah, blah, blah. And it was at the Chop House, the lecture, right?
So that happens all the time.
It's a Fellini movie. It's bizarre.
It's
The
so bizarre.
profession then wants to know the truth because they don't want to know the truth. They don't know anything about nutrition. Nutrition is held in, it's a sissy science. It's not held in respect. And the doctors are eating it themselves. They're eating the burgers and the buffalo wings. They're not going to tell their patients don't eat that. But that has to give way. That's old 1950s thinking. A tidal wave of new thought is sweeping through the country and certainly through medicine, and all you and I and all of us are all pushing this wave to sweep all that old thought out of there. We used to do a lot of things. We used to kill whales. We used to buy and sell black people. We used to do a lot of things. Well, I tell the medical students, what if you were sitting around a table and one of you pulled out a Marlboro and lit up a cigarette? What would the rest of you say? I would hope the response would be, man, are you still doing that? Are you still smoking? Really? What we need to get is the point where someone orders a steak. We want people to say, man, are you still eating that stuff? Man, that is so 20th century. And man, it's time to get on to the tofurkey or whatever. We've got to make meat eating as uncool as wearing fur, as smoking cigarettes, all that stuff we used to do. Right. No matter what meat eating did in the past, no matter what the mighty hunter, that doesn't matter. We've used it up. What's being asked of us as individuals, if you want to stay healthy, and as a species, if we want to survive, is to evolve your diet to a plant-based diet now. If we don't do that, as a human, you ain't going to live very long, and as a species, we're not going to live very long.
And
that's the order that we have used fishing up. Mm-hmm. We have used flesh eating up. That era is over. We now must focus on the era of whole food, plant-based nutrition, and that's why this show is so important. And the example that you set, and the imprimatur of good medicine.
And it's hard. And it's hard because when we have, and this is the discussion I have because I'm criticized a lot because we like to be evidence-based. But when we look at even some of the MD doctors that sell books all the time, so one guy's saying can't eat lectins and you can't do this, and or we're still pushing that. Some of them are pushing. Even some of my mentors still unfortunately push Mediterranean diet, right? Because there's an influence of a seafood industry that is the sponsor of the conferences or the we have to just move away from that. Like we have to say, look,
absolutely.
There's a little bit of like we just can't follow the sponsor saying, oh, the sponsor says eat more salmon or don't eat this. It's like what I have to look at, follow the money. Why are we following something that the data now shows it's different? And anyway, so I really appreciate your honesty and I like when you get upset because it just reminds me of me. I'm like, what are we doing here? Really, every day.
Exactly.
One of the things just really funny here is in Albuquerque in our local hospital here. It's a local tradition. We call it Frito. They call it Frito Friday, and it used to be around when I was medical student. It's still around today. Where on Fridays at the hospital they open up a bag of Fritos and they put the chili with the pork and beans and blah blah blah, all the lard and stuff in the bag, and then they put a spoon and they give it to the patient. They give this in the hospital, by the way. Frito Friday still. In 2018, and so it's like my cats. So every time my patients are like, "Are you going Friday? You got to bring your own food because it's Frito Friday."
And we don't let our patients get by with it anymore. We have many people who say, "Well, if I can't have my bacon, I'd rather die because then I'd die happy with a smile on my face eating my bacon." And you're like, "No, you wouldn't."
No, you wouldn't.
Absolutely not.
I mean, you being
Yeah.
you being an ER physician, same thing when I was in residency. We'd see people all the time that would die of cardiac arrest or these kind of chronic diseases, and no one ever died with a smile. I've never seen a single person that passed away
No,
with a smile on the face.
definitely not.
So it's this big misperception of like, oh, I want to have barbecue from here to here. I'm okay. You can have plant-based barbecue if you want, but just don't have this perception
Absolutely.
is like we want to be gluttonous and just like not care for our body or the environment or other well-being or even animal well-being is just a little bit odd or peculiar for me.
Light up the
Absolutely.
light.
And those folks who, well, I'll just get my heart attack and die, Doc. Got to die of something.
Yeah.
Yeah, well, Mother Nature's got a few tricks up her sleeve. The worst thing is that you have your stroke and you don't die.
Yeah.
And you spend your next 30 years in a wheelchair drooling with some nursey wiping your backside because you can't reach back there.
Right.
That does wonderful things for a marriage and for self-esteem.
Right.
Or you get your heart attack and you don't die, but you lose 2/3 your heart muscle, so you get out of breath walking to the mailbox, and you become a cardiac cripple. And every place you go, you have the oxygen tubes up your nose. It's not so pleasant. And so that get my heart attack and die, Doc.
Right. Yeah.
Nature's got. Don't be so sure about that. Eat plants and avoid that whole horror show. That's the best thing.
I'm gonna keep this little segment what you just said on my computer. So when I say it's not just me talking, Dr. Klaper says the same exact thing because they have to hear. People have to understand. It's like we're not trying to be me. I always tell my patients we're not trying to be holier than thou. I had to do lifestyle. We had to go through our lifestyle changes. We all grew up eating standard American diet. Here in New Mexico, we have sometimes we consider the worst diets. We're just south and southwest and close. I grew up in Las Cruces, which is near El Paso, Texas, which is obesity capital now. So really, really bad fried foods and double dairy and cheese and all stuff. But we all have to do the transition. And once you do that, it's like why we're so passionate, because when you feel good and you're optimally thriving, not just surviving. We want to be thriving, not surviving. It's like you want to share that with everybody. Like you don't have to go to the pharmacy store and pick up 12 different prescriptions and then go to the health store and try to pick up 12 different supplements and still not feel better on either end. Right. So
indeed, when we were in med school, we learned about all these terrible chronic diseases that never go away. But when you get people on the plant-based diet, what you and I have seen, sir, on a daily basis, the miracles of healing, the obesity melts away, and the arteries open up, and the high blood pressure comes down, and the joints stop hurting, and the skin clears up, and the asthmatic lungs stop wheezing, and the migraine headaches go away, and they turn into lean, healthy people who don't need a bunch of pills and potions. And this is the most powerful healing of all, and everybody can do this for themselves. And what's the cause? It means ordering the bean chili instead of the beef chili.
Yeah, I know.
That's the huge sacrifice we're being asked to make here. Please, people, don't make this worse than it has to be. There's such a glorious cuisine available: Chinese food, Italian food, East Indian food, Mexican food. All plant-based. There's a glorious cuisine here. Just leave the meat and the dairy and the oils and the sugar behind, and there's wonderful food waiting. And the reward is the most precious thing of all, and that's good health. So don't linger back. Get on with that plant-based nutrition transition, and great things await you in way of health and good eating.
And now we know what's in that pot of gold at the end of the rainbow.
Well said. That's the best part of all.
It ain't a Frito pie, okay?
It ain't a Frito pie. That's for darn sure.
I'll probably get a cease and desist letter from Frito-Lay, by the way.
Probably will, but that's okay.
Well, I really appreciate you coming on the show today. It was great. I know we had a little technical difficulty last week, but it was great. Anything that we can ever do to help work with you or share the message, we would be Maureen and I are always here to be of service, because we want to spread the message. And I do appreciate everybody. Again, everybody here who's watching on Facebook Live, go to Dr. Klaper, DoctorKlaper.com and learn more, and then follow him on Facebook, and go to his website, get those videos. Also, please sign up on Sangevity.net for our newsletter, because the show will be moving to a different time and place. And also go to our YouTube channel and subscribe so it can just come up in your feed and watch wonderful interviews like this. Any last words, Maureen, today?
No, thank you very much. Thank you for all the extra time.
Oh, absolutely. Thank you for getting this very important message out to your listeners, and all the good work that you do all the time. And I've learned a lot here as well. So thank you so much. Apologies again for last week. And
it's
okay.
No problem. All right, everybody. Thank you very much.
It's not working.
Thank you very much for joining us. Until next time, take care and best of health.